Hi, I'm Dr. Amy Sisson, Yolo County's health officer. I'm here to update you on the coronavirus situation in our local community. Unfortunately, the virus that causes COVID-19 continues to spread in Yolo County. The case rate is higher than it has ever been, and 1 in 10 residents getting tested for COVID-19 are infected. Our 2 hospitals are running out of ICU beds. Normally, low ICU beds wouldn't be a big deal. Hospitals would simply transfer people needing ICU care to other nearby hospitals. The problem now is that these other hospitals are also filling up. Unless we act now, we may soon reach a point where there are not enough ICU beds and trained caregivers to take care of the sickest patients. In this dire scenario, patients might die because they can't get the care they need. This doesn't just affect patients with COVID-19. It also affects people with cancer, heart attacks, and strokes. On December 3rd, the governor announced that regional stay-at-home orders were coming for parts of California running out of ICU beds. The weekend of December 4th, 2 other regions in California went under stay-at-home orders because their available ICU beds dropped below 15% of capacity. Yolo County is part of the greater Sacramento region. In our region, the number of ICU beds is dropping. The state model predicts that our region will drop below 15% capacity around mid-December, triggering a regional stay-at-home order for Yolo and the 12 counties around us. Most people who get sick with COVID-19 today won't end up in the hospital until 2 weeks from now. With cases continuing to rise, demand for hospital and ICU beds is only going to increase. We simply cannot wait for a state order before we make a change. We must act now. As a result, on December 4th, I issued a local health officer order for Yolo County. It targets the activities that pose the highest risk of coronavirus transmission. Those where people who don't live together come within 6 feet of each other, especially while not wearing masks. It makes 3 main changes to the purple tier restrictions already in place. First, the order allows only people who live together to eat together at restaurants. Because you can't wear a mask while you eat and drink, it is important to only share a table with people you live with. Second, the order limits all retail businesses to 20% of their usual capacity and requires them to count people entering to make sure the cap isn't exceeded. This cap applies equally to big box stores and small businesses, regardless of what they sell. With fewer people in a store, people will be able to stay at least 6 feet apart at all times. And third, the order ends all athletic practices and competitions for youth, college students, and even professionals. Outdoor training sessions where athletes can remain at least 6 feet apart at all times may continue. Sports that bring athletes from different households close together without masks are simply too dangerous right now. While the new local order doesn't require you to stay home, I strongly encourage you to stay home as much as you can. Stores are staying open for now, but that doesn't mean you should spend hours leisurely shopping. Get in, get out, and go back home. There is more virus in Yolo County now than there has ever been. This means that activities that used to be safe simply aren't safe anymore. Don't assume that because you did something last month and didn't get sick, that you will be fine doing that same activity now. This is especially true for gatherings. Gatherings are strongly discouraged. Gatherings bring together people from different households and provide opportunities for coronavirus to spread. If you must gather for some reason, keep your gathering outdoors, small, short, and make sure everyone wears masks and keeps their distance. This order only applies to Yolo County, and it won't keep our region from triggering the state's stay-at-home order. But it will slow the spread of coronavirus and shorten the length of time hospitals are strained, and in doing so, it will save lives. We won't have to do this forever. The COVID-19 vaccine is coming. In fact, Yolo County expects to begin vaccinating healthcare workers and long-term care facility residents later this week. There is light at the end of the tunnel, but we are still in the tunnel. Please do your part to save lives by staying home and not gathering. It might not be just your own life that you save, but it could also be the life of your parent, your spouse, your sibling, your coworker, or your neighbor. Thank you.